Do you know the 7 alarming indicators of diabetes? Recognizing these indications is not just crucial, it's potentially life-saving. As the 6th leading cause of death worldwide, diabetes is a silent killer that can strike when you least expect it. The early recognition of these 7 signs allows for timely intervention, halting the progression of the disease and preventing serious complications. By identifying these symptoms in time, you can take early action, get the right medical attention, and ultimately save a life. So, let's delve deeper into understanding these telltale signs. Our first point of focus is the phenomenon of blurry vision. This is not the usual type of blurry vision that one might experience after a day of continuous straining at a computer screen, or the kind you get when you misplace your glasses. Here we are discussing a sudden unexpected shift in your vision, where everything appears as though you're looking through a foggy glass pane or a misty veil. The sharp crispness of your surroundings suddenly seems to blur and dissolve, leaving everything indistinguishable and vague. This isn't a mere inconvenience, but a serious alarm bell. It is your body's ingenious way of signaling a potentially critical situation. Your blood sugar levels may have skyrocketed to dangerously high levels. Such a sudden deterioration in vision can indicate that your body's glucose levels are not just slightly elevated, but possibly at a level that necessitates immediate medical attention. Moving on to nausea and vomiting, it's important to understand that these are common symptoms associated with a wide array of issues. However, things take a serious turn when these symptoms start meshing with others on this list, potentially indicating a red flag for diabetes. You see, our bodies have a delicate balance of sugar in our bloodstream. When this balance is disrupted and we have higher than normal sugar levels, a condition associated with diabetes, it can cause a host of problems. Too much sugar in your bloodstream can affect your body's regular digestive process. It can slow down your gut movements, leading to a feeling of fullness and resulting in nausea or even vomiting. Moreover, high blood sugar levels can cause nerve damage in diabetics, known as diabetic neuropathy. This nerve damage can lead to gastroparesis, a condition where the movement of the stomach muscles is slowed or stopped, causing nausea and vomiting. So, while it's true that nausea and vomiting can arise from countless scenarios, when they're paired with other symptoms such as frequent urination, excessive thirst, or unexplained weight loss, it could be indicative of diabetes. It's essential to pay attention to these signs, as early detection can help manage diabetes effectively. Thirdly, let's discuss the phenomenon of fruity breath. It's important to note that this is not a result of apple you had for lunch. When your breath takes on a unique, sweet and fruity smell, it directly points towards an indication of a substance your body produces: ketones. Now, why does your body produce ketones? When your body lacks sufficient insulin to convert glucose into energy, it resorts to burning fat for energy. This process subsequently leads to the production of ketones that are eventually released through your breath, giving it that fruity smell. But this is where the real concern lies. This could be an early warning sign of a perilous and potentially life-threatening condition known as diabetic ketoacidosis. Diabetic ketoacidosis, often known as DKA, is a severe complication that people with diabetes face when their body starts to run out of insulin. Without enough insulin, your body begins to break fat as fuel, which leads to a buildup of acids in the bloodstream called ketones, eventually leading to diabetic ketoacidosis if not treated immediately. The fruity breath, hence, is not just a harmless symptom but a possible alarm bell tolling, indicating that immediate medical attention is required. The fourth sign is rapid breathing or shortness of breath. This isn't just the familiar panting you may experience after an intense workout. Rather, it's an unexplained breathing, often accompanied by a distressing sensation of unable to catch your breath. This could be a result of your body's desperate attempt to expel excess carbon dioxide. Under conditions of high blood sugar levels, your body is thrown off balance. Excess glucose in the bloodstream can interfere with the normal functioning of your organs. As the blood thickens due to high glucose concentration, your lungs struggle to extract the necessary oxygen, and this may result in hyperventilation or rapid breathing. Additionally, your body also tries to rectify the situation by increasing respiration to eliminate more carbon dioxide, a waste product of metabolism, thus causing you to breathe faster and deeper. Therefore, persistent rapid breathing could be indicative of your body's ongoing battle to restore equilibrium amidst elevated blood sugar levels. Sliding into the fifth spot on our list is confusion, or an altered mental state. If you're experiencing an unusual sense of disorientation, akin to feeling lost in a familiar place, or discovering it's challenging to maintain focus on routine tasks. These could be signs of high blood sugar levels. Similarly, sudden memory issues such as forgetting recent conversations or struggling to recall common words could also be an alarming indication. These symptoms can manifest subtly but are insidious, a result of your brain undergoing changes due to elevated glucose levels in your blood. They can escalate over time, impairing your cognitive functions if your blood sugar levels persistently remain high. It's critical to not take these signs lightly and seek medical advice promptly, as they could be your body's way of signaling that your blood sugar levels are dangerously high. The sixth sign is weakness or fatigue. It's completely normal to feel tired after a busy day, but if you find yourself constantly drained of energy, it might be indicative of a deeper issue. This unexplained, persistent fatigue can be your body subtly signaling that it's not effectively converting glucose into energy. In a healthy system, glucose is metabolically broken down into usable energy units called ATP. However, if your body isn't doing this efficiently, it could mean you have a metabolic disorder or insulin resistance, leading to your cells being starved of energy, hence the consistent fatigue. This isn't just a feeling of being worn out either. It's a profound lack of energy that can also be accompanied by other symptoms, such as difficulty concentrating, muscle weakness, and slower reaction times. Finally, we come to the topic of abdominal pain. This is not the standard discomfort you might feel after a heavy meal or a minor digestive upset. It's a sharp, relentless pain that refuses to fade away. This could potentially be your body's distress signal, indicating an issue with your pancreas, which is unable to cope with excessively high blood sugar levels. This pain is usually centralized in the upper abdominal area, radiating towards the back. It is often accompanied by nausea, vomiting, and a rapid pulse. The sustained pain could be an early sign of pancreatic inflammation or pancreatitis, which is often linked with high blood sugar levels. When blood sugar levels reach extremes, the pancreas is forced to work overtime to produce insulin. This increased demand can lead to inflammation and damage, resulting in this sharp, persistent pain. It's critical to pay attention to this potential symptom and seek immediate medical assistance to prevent further complications. So there you have it, the 7 critical alert signs of diabetes. First is the blurry vision, which is often a result of high blood sugar levels affecting the tiny blood vessels in your eyes, causing them to swell. Next is nausea and vomiting, which can be a sign of diabetic ketoacidosis, a potentially fatal condition if left untreated. The third sign is fruity breath. This can be an indication that your body is using fat for energy instead of glucose, producing a sweet, fruity scent. Then we have rapid breathing or shortness of breath, which can be a sign that your body is struggling to balance its insulin and sugar levels. Confusion or an altered mental state comes next. This can be a symptom of severe low or high blood sugar levels affecting your brain's normal functioning. The penultimate sign is weakness or fatigue, a common symptom when your body doesn't have sufficient insulin to convert glucose into energy. Finally, abdominal pain, often severe, can be a sign of pancreatitis or biliary colic, both of which are more common in people with diabetes. Always remember, if you or anyone you know is experiencing these telling symptoms, seek immediate medical help. These signs are not just mere discomforts, they are your body's urgent distress signals, warning you that something is gravely amiss. Never turn a deaf ear to them. Early detection and prompt treatment can drastically change the course of this disease when it comes to diabetes. Staying informed is not just about understanding the symptoms, it's also about knowing your risk factors and being aware of the latest research in diabetes management. Being vigilant involves regular checkups, tracking your blood sugar levels, and maintaining a healthy lifestyle. And staying healthy is not just about physical well-being, it's also about mental wellness. So ensure you know these signs, stay informed, stay vigilant, and above all, stay healthy in your fight against diabetes.